Hey, I'm Dr. Brian McKay of Core Health in Darien, and today I'd like to talk to you about back pain, low back pain, especially during pregnancy. There's a couple of things you can do to protect yourself. I mean, pretty much you're going to be sure that at some point in your pregnancy, along with the nausea, fatigue, and swollen feet, most women will experience back pain at some point during their pregnancy, and it typically affects the lower back or the pelvis. Um, there's some estimates that it's more than two-thirds of women during pregnancy will have some back pain. It kind of starts near the center of the back, and we call that lumbar back pain or low back pain, or it goes into what we call the posterior pelvic pain, which is kind of the tailbone. And there's many factors that contribute to this. I mean, there's postural changes, there's the weight gain, your center of gravity is changed. So there's a number of different factors that come into play here. And there's also hormonal changes, which is, your hormones are changing. So it does, this is pretty tricky. So during the first trimester, let's address the hormone, what goes on with the hormones in the body. So during the first trimester, levels of progesterone increase rapidly. And what happens is this hormone helps to relax the muscles and joints and ligaments near the pelvis, which can affect the stability and the alignment of the joints, leading to pain. Another hormone we call is relaxin. And what the relaxin helps do is it helps the egg to implant on the uterine wall and prevents contractions during the early stage of pregnancy. So relaxin is a pretty important thing. And then as you near labor, the relaxin stimulates the cervix to soften, and so you can open up the pelvis in preparation for delivery. So these are some of the hormones that you really you need to be aware of when you have back pain during pregnancy. Um, so the other thing we got to think about is stress. Pregnancy is an exciting time in your life, but it is a source of stress. And stress can cause many physical symptoms such as fatigue, headaches, stiffness, and muscle pain. So that's what you got to kind of be concerned with, during the early, during the first trimester. Now, as you get to the second trimester, the uterus continues to expand as the fetus grows. And again, so now you're going to see more weight gain and muscle separation, which all contribute to back pain in the later stages of pregnancy. So here's what's happening. As a woman's center of gravity shifts to the front of the body as the baby grows in weight, you get a tendencies to lean backwards to regain balance. And so when you're leaning backwards, you put extra strain on the back muscles, what can lead typically to low back pain and muscle stiffness. Um, the weight gain during pregnancy will always contribute to low back pain and joint pain. Um, and the amount of weight a woman puts on during pregnancy can impact her and a baby's overall health. Um, typically, typically just give you an idea, um, 28 to 40 pounds, um, you know, is typical weight gain. You can go up to 25, 35 on a healthy, 15 to 25 pounds if you're overweight, and 11 to 20 pounds if you're obese already. So it's tough. Pregnancy is tough. I cannot relate. I mean, although I do have 5 kids, but I definitely can't relate to the pregnancy pain. But I got to tell you, the one thing is when patients come in here and they are pregnant and have back pain, kind of make it a mission to get these people better as fast as possible. I mean, we all know you've got better things to do than have back pain, but we want to, so what we do is we have a physical therapist on staff, as well as me and my chiropractor, Dr. McKay, and Ruben Carney's an incredible physical therapist. And what we like to do is we work together because you do need some physical therapy, you need some massage. A lot of times people are concerned when they go to chiropractic it's going to hurt the baby. And there are a number of safe, comfortable, and effective techniques, primarily activated technique, which is one where we had to use a handheld tool. And we have a special adapter so that the pregnant mom to be can lay face down on the table and get treated. So we really want to operate in that safe, comfortable, and effective area. So the muscle separations, I mean, that's a tough one because the stomach muscles consist of two parallel bands of muscles that connect in the middle of the abdomen, and these muscles, your core muscles, help stabilize the spine and support the back. And during pregnancy, the fetus pushes against the abdominal muscles, causing them to stretch and in some cases separate, and the pressure can result in what's called diastasis recti, which is where the kind of you see the belly button popping out, as the stomach muscle pushes, as the fetus pushes against the core stomach muscles. Now, in typically in the second and third trimesters, some women may develop a little bulge in the stomach, and that's a sign that their abdominal muscles are separating to allow room for the baby. But you have to think about it, as the muscles stretch, they become weaker, and this increases the chance of someone having, um, you know, you know, having a low back pain or developing low back pain, especially during pregnancy. So, what is typical? Well, it's not typical. There are a number of stretches you can do. Um, as a matter of fact, if you reach out to me, I'll be more than happy to send you these. I'll forward over some safe exercises. You know, that can really make a difference, because you really, as you know, you can't really take a medication for when you're pregnant. So, there's very little medications you're offered. So people are mostly encouraged to do stretching. A couple ways to you can relieve it at home is regularly stretching lower back, sleeping on the side with a pillow between your legs and below the abdomen, and using warm compresses to relax the tight muscles and reduce inflammation. Um, you can definitely make some postural changes, such as standing and sitting upright so the back is straight and shoulders are square. I recommend for some people wearing a maternity belt for the extra abdominal and back support. Use a lumbar pillow when you're sitting, and also too is prenatal massages are really important to relax muscles. I don't think your husband's gonna bitch too much if you if you say you're going to get a massage. But again, that's another thing is you just don't go for anyone for a massage. You want someone who's trained in that. Fortunately, we have Jacek Strakuski here, who is trained in prenatal massages, which will definitely help relax the tight muscles, improve the range of motion, and it's going to decrease your stress. You will sleep better. There's nothing. There's all good stuff that comes from a massage, but I do caution you. You go to the nail salon and get a massage. I'm not so sure that's a great thing to do. I think it's nice when you're not. I'm not trying to talk you down. I'm getting your nails done, but I think sometimes those massages are not really done by professionals, and your baby deserves the best care. So I would suggest that you go to a good prenatal massage therapist. We just happen to have one, but it's not going to be. I don't want you to consider this a shameless plug for Core Health Darien. Now, acupuncture is another way of treating the for pregnancy, you know, and chiropractic, but you have to have someone who knows what they're doing. Remember, safe, comfortable, effective. You can also do some meditation, prenatal yoga, and getting good rest. I mean, these are all, common sense things that I think um, but, this is why you're listening. So hopefully you're going to get some information. So let's go for some tips to prevent and avoiding pain during pregnancy. You want to strengthen the back muscles with pregnancy-friendly exercises. You want to maintain a healthy weight throughout the pregnancy. You want to do gentle exercise that your doctor recommends, and I'm more than happy to work with your obstetrician to do that. Um, a good thing too is to wear flat or high heel shoes with arch supports. Avoid standing for a long time. And don't lift too much weight. And when you do have to lift, do it properly. Squat down and use the legs instead of the back. Try and practice good posture and avoid sleeping on the stomach. Now, if the pain is getting to be too severe, I want you to go to your obstetrician first. You do not come to Core Health Darien at all. I'd love to help you, but and especially pain that lasts more than 2 weeks and cramps that occur at regular intervals and intensify. So, you have pain urinating. Again, I want you to go see your primary care doctor. Tingling sensation, bleeding, discharge, fever. These are all things that I really prefer that we work and coordinate with the obstetrician. It's very important. And you can get sciatica as a result of, especially during pregnancy. And the growth, what happens is the fetus puts pressure on the sciatic nerve. And so that typical sciatic type of pain will go radiate through your buttocks and even down the leg. Um, but again, longer than 2 weeks, we got to do something, because no sense having you further stressed out, because the stress on you puts stress on the baby. We definitely don't want that. So you always got to start with, any new medication, supplements, or naturopathic treatments. I think it's a good idea to discuss that with your obstetrician. And they're really, really good about all this stuff. Um, it's back pain is fairly common. Again, it's from increasing hormone levels postural change, weight gain, muscle separation, stress on the body. After the baby comes out and is born, usually you're pretty much good on the pain that's related to pregnancy, but it might not be a bad time to start some physical therapy. So what I'm going to suggest you do is, if you have any questions, talk to your healthcare provider, and then you can reach out. We're located in Darien on the Post Road. Our phone number is 203-656-3636. 203-656-3636. Come in for consultation. There's no charge for consultation. And in doing so, we're gonna take good care of you. I promise. We want you to have a healthy baby, and we want you to stay stress-free and pain-free throughout your pregnancy. I'm Dr. Brian McKay from Core Health Darien, and I'd like to thank you for listening. Again, you got any questions? 203-656-3636. 203-656-3636. Thanks for listening. Have a healthy baby and a pain-free pregnancy.